What is invasive lobular carcinoma, ILC? Imagine a type of breast cancer that begins deep inside the milk-producing glands of the breast, called lobules. When this cancer spreads beyond these lobules into nearby breast tissue, it is known as invasive lobular carcinoma. This form of cancer makes up about 10 to 15% of all invasive breast cancers and is the second most common type after invasive ductal carcinoma, which starts in the milk ducts. Unlike other breast cancers that often form a noticeable lump, invasive lobular carcinoma tends to grow in a single cell pattern or spread out in sheet-like layers through the breast tissue. This growth pattern makes it harder to detect with a physical exam or even a standard mammogram because it doesn't always create a clear, distinct lump. Instead, it can cause subtle changes that are easy to overlook early on. Symptoms of invasive lobular carcinoma can be quite subtle. You might notice thickening or swelling in part of the breast, or sometimes both breasts. Changes in the shape or size of the breast are common, with one breast appearing larger or different from the other. Skin changes such as dimpling, puckering, redness, or a texture similar to an orange peel can also occur. Nipple changes are another sign, including inversion, pain, or unusual discharge that isn't breast milk. Swelling or lumps in the underarm area, where lymph nodes are located, may also be present. Some women experience tenderness or pain in the breast or nipple area. Because invasive lobular carcinoma grows diffusely and doesn't always form a distinct lump, it can be difficult to detect early with routine mammograms. Sometimes additional imaging tests like magnetic resonance imaging or ultrasound are needed to get a clearer picture. If you notice any unusual changes in your breast, it's important to see a healthcare professional promptly for evaluation. Risk factors for invasive lobular carcinoma are similar to those for other types of breast cancer. These include increasing age, being female, having a history of lobular carcinoma in situ, hormone replacement therapy after menopause, and certain genetic factors. The exact cause of this cancer isn't fully understood, but it involves changes in breast cells that lead to uncontrolled growth. In summary, invasive lobular carcinoma is a unique form of breast cancer that starts in the milk-producing lobules and spreads in a diffuse pattern. Its subtle growth makes early detection challenging, so being aware of changes in your breasts and seeking medical advice early can make a big difference. Treatment options follow standard breast cancer protocols and are tailored to each person's specific situation. Always consult with healthcare professionals for personalized advice and care.